The Promoting Continence resource has been developed to be used by people living with dementia and other long-term conditions, as well as their families and staff working across health and social care. So, whether you are a nurse working on a busy NHS ward, part of the care at home team, support worker in a day centre, or a manager of a care home, there are valuable messages in this resource.
It's one of those resources that is good for everybody. So it can be used by people popping into their GP surgery and thinking, you know what, maybe this is something I need a bit more information about, or for people working in frontline services. If we get the little things right, we know that we can keep people continent for much longer, which actually has a huge impact on their health and well-being.
The reason for the resource is from the information that we were gathering as part of our electronic annual return every year was showing that there was a really high prevalence of incontinence within our registered care home services. So it made me then question, why is that? And look behind to see what might be the barriers to promoting continence and good continence care.
Continence care is about helping people control their bladder or bowel functions. This can include suggesting ways how to keep the bladder and bowel healthy, undertaking a detailed lifestyle assessment and knowing what matters to an individual, identifying the right treatment, and, where cure is not possible, giving emotional support and advice around products that support people to lead active lives.
Making the first step to contact the continence service is as big, I think, as somebody making the first step to contact a sexual health clinic or a mental health team, because it's traditionally a societal taboo to talk about bowel and bladder. People suffer alone, they buy pads that are not appropriate, they deal with symptoms for years and years and years without even telling their nearest and dearest. They leave work because they have a perception that people at work know that they have a problem. So it's about, I think, breaking the barrier down, and the more comfortable we are to talk about it and the more comfortable we are to acknowledge that we all potentially at some time will either have a continence issue or be caring for somebody with a continence issue, I think those barriers will start to go.
It's absolutely central to everything, promoting continence. It's the biggest impact it can have on somebody's quality of life if it's not managed properly. How we keep it moving is to keep it actually built into people's training needs, part of people's induction, staff induction, and just basically revisiting it every single time when you're doing that whole assessment process, is to put continence there as a key indicator of quality of life.
Talk to me. Make sure you're talking to me in a language that I can understand. Don't use acronyms like that. Tell me what's available. Tell me what the latest thing is in continence. You need a person there to actually talk to you, to run you through it, to take the embarrassment out of it, to make it all right. And if that professional's there speaking to you, telling you about it the whole time, relaxing you, that's the whole point. And they can. The one that came here was brilliant. She was absolutely brilliant. We had a laugh about it. So that's a good thing. If you can laugh about incontinence, you can laugh about anything.
The assessment is really important as it really brings in the focus to the individual person. It's really about making sure the person's central to that assessment, ensuring that we're actually picking up the issues that impact on that person's life on a day-to-day basis, which will ultimately involve improving their quality of life and ensuring that they still feel that they have a purpose to play in life and that they're actually key to the whole process.
There are some things that we never share with our loved ones, and toileting is one of the things I think people very rarely share, and that actually at end of life that has huge implications. And I would urge people to share those things with their loved ones while they're healthy. Because perhaps one of the really important things that I look back on now, which I wouldn't have been able to tell a care home, is what my mother's normal toileting routines were. And I realise that if those are not addressed, then someone's day-to-day comfort is impaired.
Assisting a person to the toilet should not be seen as a task, but an opportunity to engage and connect with the person, being aware of any changes to mobility or mood, for example, seeing the whole person.
How important are the details? They're the key, aren't they? That's the key that will open the door to whether somebody's going to be continent or incontinent.
Communication is very important when we're supporting residents, and that would include communication skills with the residents and their families. Sometimes residents might have impaired communication, so it's really important that we obtain some information from the families.
I think the biggest thing for my mother is that she wouldn't realise she needed the toilet, and you would ask, we're going to the toilet, and she would say, I'm not needing it, and you'd say, okay, let's go and try, and it was still, I'm not needing it, and then we would just say, right, okay then, £1 to pee, because that's how she said it, and she would say, I've no money, and then we would take her through, so it became a part of a little situation that worked for us.
On experience in the home, some of them will ask you verbally, I need to go and I need to go now. Some will be kind of fidgety and kind of get distracted. You need to prompt them and say, are you needing the bathroom? You know, because they get embarrassed. Sometimes they don't want to say, I need the toilet. You know, but and everybody's got different retail signs. So, you just kind of watch it. But it's just years of practice and knowing your resident.
People coming into a new environment will need time and support to orientate themselves so that they can find the toilets and know how to ask for help. Staying active and having a good choice of healthy food and drinks will promote a healthy bowel and bladder.
I have a plea that when you have a new admission come into your service who are deemed incontinent, that you actually you don't accept that, you look beyond that and see with 24-hour care whether you can improve that person's life.
It is important to know if the person you are supporting has any sensory loss. This could be as simple as making sure that glasses are clean and hearing aids are working.
Sensory is kind of a bee in my bonnet, and often I think there is a lack of understanding of different sight conditions. So older people and the predominance of macular degeneration nowadays in older people, and how that sight is interpreted, and the lack of maybe central vision, and often staff don't know what the specs are for.
If a person is taking any form of medication, we want to make sure that it does not stop them from engaging in their usual activities or from going out and enjoying themselves.
Medication is obviously something that you have to assess appropriately to ensure that if you're actually going to make any alterations to medication, it's also done in line with discussion with the general practitioner.
The times of medications can vary depending if a resident's maybe going out with their family. If they're going to, say, a church service, they're going to a family gathering, then we can look at what's the best thing for the resident to ensure that they have the confidence to go out with their family, that they feel safe going out with their family, but also that their continence needs are met within the new environment that they're going to.
We need to think about the environment and some of the barriers that may cause people to be incontinent. These might include lack of signs showing the way to the toilet, poor lighting, or not being able to reach a walking frame to walk safely to the toilet. Take time to think if there are barriers within your service that do not support continence, and how you could remove them to get better outcomes for the people you support and care for.
When we're looking at the physical environment within care homes, we would be reviewing the signage within the care homes. We would review the contrast. We would be looking at the lighting.
The most important thing when a new resident comes into the care home is ensuring that the environment and that the environment they're going to be in, that they're orientated to that environment. It's very important because obviously they're coming into somewhere where they haven't been before, and us as care staff have to give them the opportunity to settle within this new environment that they're in.
Continence can be promoted in a number of ways. It should not be stressful, embarrassing or ignored.
The staff have to appreciate exactly what continence is. We provide a very robust training schedule with regards to how we promote continence within the home, and what we try to do is we try to get the staff to put themselves in the position of the resident, because continence is something that can be so debilitating for somebody.
Sometimes there's a culture that becoming incontinent is just the accepted way of being, and we know that's not true. So we want to have staff, relatives, really thinking about what can we do to keep the person that we're supporting continent for as long as possible.
I think the key message that I would have to support this resource is think about the individual and not about their age or their abilities or their disabilities. To be creative, to look at the actual person and what they're going through, and even if they can't verbalise that they're embarrassed or they feel that their dignity has been compromised, we know that they do. It's not normal to be incontinent, and I think the key message is just that.
I'm hoping that the resource will lead to people actually questioning their own beliefs and their service culture and their organisational culture about bowel and bladder health, and ask the question why. If they have a high prevalence of incontinence, go back to the drawing board and ask the question why. Is it staff understanding, or is it the barriers I'm putting in place within the service that are stopping people from getting to the toilet? Or are people truly incontinent? Well, that's fine, but get them the right product that's best for them, that helps them lead a better quality of life.